On February 11, 1945, the Emergency Civilian Administration established an indigent children's clinic in the building of the defunct Bureau of Public Welfare at San Rafael Street, Manila, to take care of the war refugees, the sick, and undernourished children. This was the humble beginning of what blossomed to become what people now recognize as the National Children's Hospital. By virtue of Commonwealth Act No. 705 in October 1945, the Indigent Children's Clinic attained its hospital status as the Indigent Children's Hospital, and in December of the same year, Dr. Peregrino H. Paulino was designated Chief of the hospital. In 1947, the hospital was transferred to a two-story house in Gastambide Street, Sampaloc, Manila, but this building, however, proved inadequate for the fast-growing hospital. The director's desire and ambition to see a better and modern hospital solicited the help of the former Secretaries of Health as well as the officials of the executive and legislative branches of the government. These efforts saw its reward when the late President Elpidio Quirino issued Presidential Proclamation No. 439 assigning the Mori Bicycle Compound at España Extension in Quezon City to be the future site of the Indigent Children's Hospital. In 1952, Republic Act No. 731 changed the name of Indigent Children's Hospital to National Indigent Children's Hospital. Subsequently, Republic Act No. 1340 dated June 16, 1955, changing the name of National Indigent Children's Hospital to its present name, the National Children's Hospital. On July 1, 1960, Dr. Jose C. Joben was appointed as Chief of the hospital. He ordered the landscaping of the grounds and the regular painting of the buildings. Aside from the improvements in the physical facilities of the hospital, the professional and service areas were given top priority. During his tenure, the hospital expanded even more. The hospital services offered was proof that the organization can stand side by side with other leading medical centers during that time. In August of 1976, the administration of the hospital changed hands with the appointment of Dr. Crisanta de Joya Agregado. Under her management, the organizational structure of the hospital was at once reviewed and revised. The objectives of the hospital were fashioned to jibe with the overall thrust of the new society under the Marcos administration. The increasing number of patients found the need to increase the hospital's bed capacity. Thus, in 1977, an additional third floor of the main building was constructed. Subspecialty care units were established including the intensive care unit, neonatology unit, and a surgical unit. To cater the increasing number of patients who come for neurodevelopmental evaluation and management, the Child Developmental Center was conceived and created on 1987. The hospital slowly became recognized also as a training hospital, thus the increased number of student affiliates. The Pediatric Presidency Training Program started and was accredited by the Philippine Pediatric Society as Phase 1 and 2 in 1981. April 16, 1988 marked a new era in the history of National Children's Hospital when Dr. Maria Isabelita S. Vital Gozon assumed the position of Medical Center Chief. Armed with enthusiasm and extraordinary vitality, Dr. Gozon did not waste any time and started propelling the hospital towards the vision of becoming an excellent center of wellness. The chief faced the challenges head-on, and for more than a decade, NCH has steadily grown and evolved to become an institution whose noble mission is to ease the suffering of the Filipino children. NCH became known for its hydrocephalus center, hence, referrals from all over the country were being served. Also under Dr. Gozon's administration, working conditions including a clean, orderly physical surroundings and supportive employees have become commonplace, giving everyone a chance to work with an elevated morale. Some of the physical upgrading of the hospital facilities were the installation of the communication facilities, renovation of the conference rooms, and improvement of water system of the hospital. A 1,000 square meter lot adjacent to the hospital was acquired to give way for the future expansion of its services. The upgrading of training and continuing education was given special attention aside from the improving of the hospital services. The postgraduate course in pediatric that started in 1991 was then conducted annually, chaired by the department's competent consultants. Several sessions of pediatric advanced life support seminars were also being conducted. A training course for nurses, the Basic Skills Training Course, has been regularly undertaken. In February 2002, Dr. Marietta R. Shonka was appointed as the new Chief of Hospital. Under her leadership, Total Quality Management Program was organized and launched. This became a priority program for the hospital. Quality circle teams were created in all services and departments. Weekly TQM meetings were conducted to review, write, and standardize various processes. This empowered the workers to actually evaluate and improve on their own work practices. In September 18, 2006, Dr. Robert Enriquez became the new medical center chief. During this time, the hospital was at the forefront thrust of DOH towards ensuring quality assurance and patient safety. With this thrust, the entire hospital, under the guidance and direction of TQM, worked together and achieved the Center of Excellence accreditation on July 10, 2010. The National Children's Hospital became the first government hospital to achieve the highest accreditation given by the PhilHealth. Under Dr. Enriquez's headship, construction of a new 6-story medical arts building was started in the 1,000 square meter vacant lot. This new building will provide new space for the following: outpatient department, doctor's clinics, dental services, imaging services such as X-ray, CT scan, pharmacy complex, and additional patient wards and training rooms. Other areas of the hospital in the older buildings were improved and renovated to provide a better environment of care for the patients and for the staff as well. Hospital programs and trainings were further strengthened by upgrading quality training of pediatric residents and other hospital staff. The Pediatric Residency Training Program, accredited by the Philippine Pediatric Society, was upgraded to Level 3, and a fellowship program in pediatric surgery was started. New hospital program services was started, such as the Touch Therapy Institute, first of its kind in the Philippines, drug-dependent treatment and rehabilitation for minors, and the strengthening of the tuberculosis control program through the public-private mixed directly observed therapy short course. Cardiac surgeries for congenital heart defects were also started. Due to the untimely demise of Dr. Enriquez, a new medical center chief, who is also the former chief of medical professional staff, Dr. Epifania S. Simbul, took over the headship of the NCH on June 1, 2011. Working further on enhancing the previous achievements, the hospital staff continued to work to sustain and deliver excellent patient care. In the first year of Dr. Simbul's term, the hospital received the Red Orchid Award, the highest award given to institutions for the efforts in maintaining 100% tobacco-free environment, Gold Award for Ospital ng Malinis at Mabango given by the Department of Health, the Philippine Society for Quality Healthcare Partner in Quality Award, and the Gawad Kilasag, second place for Best Medical Institution advocating disaster risk management. The administration also worked hard to achieve the ISO certification status of the institution, and the hospital was finally accredited by TÜVSÜD in August 2014. The institution's trust of its commitment to quality service is further strengthened by the partnership with kind-hearted private individuals and non-government organizations. Indeed, their contributions played an enormous role in making accessible quality healthcare a reality. As of 2015, the mobilized community resources were worth more than 22 million pesos, to which more than 12 million pesos was from various non-government organizations, more than 7 million pesos came from different government organizations, and more than 1 million pesos came from the different private individuals. Out of this amount was the birth of enormous assistance in terms of drugs and medicines, medical procedures, and medical equipment. All of these were translated into provision of an improved quality healthcare for the patients. The hospital has been the frontrunner in the care of pediatric patients in different stages of life and different types of diseases. The delivery of services for indigent patients is done through innovation, sourcing out of funds and sponsorship, collaboration with government and non-government organizations and individuals. Through the years, National Children's Hospital was continually grown, evolved, and expanded with the changing times. This edifice has been and will always be a living testament of loving quality patient care and concern for all Filipino children.